Urinary tract infections are incredibly common. We see 11 million cases per year in the U.S. alone. Women specifically have a higher risk for urinary tract infection for a couple of reasons. One, they have a shorter urethra than men, and this allows for bacteria to more easily colonize the bladder and cause infection. In addition, the hormonal changes that occur during a woman's reproductive lifespan can also increase the risk of urinary tract infection at certain times. More than 60% of women will experience at least one urinary tract infection in their lifetime, and many have recurrent. There are many preventative measures that I recommend in my office all the time to prevent recurrent urinary tract infection. Wiping from front to back during toileting is very important. Hydrating well on a day-to-day basis with water is beneficial. I always recommend urinating after sexual activity in an effort to mechanically flush bacteria from the urethra. I always recommend consideration of a supplement that contains clinical dose of whole cranberry fruit, such as that found in Eucora Flush Advanced Plus. This supplement not only has clinically efficacious cranberry, but also D-mannose, so it works with a dual mechanism to help to prevent recurrent UTI in healthy women. Well, urinary tract symptoms are usually easily depicted by women and very familiar to those who have ever had a urinary tract infection. We always notice urinary frequency, an intense urge to urinate, and of course discomfort and burning with urination. I advise hydration right away with plenty of water. I advise over-the-counter analgesia for the discomfort if needed. And I typically advise, again, a supplement such as Eucora Flush Advanced Plus with whole fruit clinically dosed cranberry to help to rid those symptoms. Certainly, if symptoms progress to fever and chills, back pain, or blood in the urine, one should check in with their healthcare provider. Cranberry has actually been very well studied, and as an ingredient in clinical dosing is advocated by the American Urologic Society to prevent recurrent urinary tract infection. Cranberry contains something called PACs. This makes the bladder much more slippery to the common bacteria that causes urinary tract infection called UTI. When the bladder is more slippery, this bacteria cannot stick to the bladder as well, and thus the risk of recurrent infection can really be diminished. Please visit us for more information at eucora.com. The website is not only good for discussing product offerings, but also has lots of good general health information about the urinary tract and community as well.